devices start to tap into wellness. So we have modalities now that are addressing anxiety and high cortisol levels and sleeplessness, insomnia. LPG Endermologie is a really interesting device, and you're sort of one of the first clinics, I think, in the UK to be using it and using its new protocol. So I'd love to dive into that a little bit and understand about what makes this device so relevant now to building that stronger body.
It is a brilliant way to tackle several problems, really. It's such a versatile device. It really helps us, sometimes starting from superficial problem, a little bit of cellulite, skin laxity, patients just want to look a little bit, better before summer, and that spikes the curiosity. But then when we actually discuss what else can be done, and when they experience how relaxing this treatment is, it's actually fascinating what it could do.
But because it does have its origins originally in cellulite. I mean, back in the day, and it's been around for some time now.
It was the go-to
cellulite treatment.
Yes, it's been a very popular device in France, in Poland, where I come from, in many European countries, and more recognized here in UK, thankfully, because that's something that really helps to address many problems. So from treatment of the scars, obviously cellulite and skin laxity, as we explained, to the wellness protocol, which helps to relax the muscles that sometimes are very, very tense. And it's interesting to actually experience how this mechanical cellular stimulation, as it's called, how this little handpiece just glides over the body and almost like sticks to those areas where we have higher muscle tension, and how it relaxes it in a very consistent way. So it's super relaxing. Patients wear those beautiful wide body suits.
It's very Instagrammable.
It looks beautiful, and yes, as you said, it's very pretty. But the impact on stress, 50% reduction of stress in patients that had a course of 10 treatments, reduction of cortisol, 45% after 10 treatments, 19% after one session. That's significant number.
It really is, and actually you're right. I remember I had the treatment myself maybe a year or so ago, and it got stuck on this bit of my lower back, which is always the area that I carry tension. Every time I have a massage, it's the bit that makes me like jump out of my skin when they sort of get their sort of hand into it. And also it got stuck on my C-section scar. So it does go to show that it is manually breaking, I guess, the scar tissue down and stimulating the oxygen back to the area and the circulation.
So it helps with lymphatic drainage. It helps with, it starts to bring more oxygen to those tissue and remove the toxins from those areas. So it really helps with the blood flow. But it's such a nice experience that it does really lower the cortisol. Lowering the cortisol then improves the quality of sleep. So insomnia improves, and when insomnia improves, our immune system works better. And it's like this vicious circle of stress, muscle tension, anxiety, poor sleep, poor nutrition, and then weight loss, and it literally just circles like that. And if we can break it, it is very powerful thing to do that.
No, 100%. And I also think what's so genius is when you find a treatment that delivers on that, call it superficial level, aesthetic level, but also that has a deeper rooted impact, I suppose, on how you feel and how well you are. I think that's sort of really key, and that's what we're looking for now. I mean, you mentioned lymphatic drainage there, and I think it's interesting because, again, lymphatic drainage has been around for 100 years, but it's definitely having a moment again now. So why is understanding our lymph and really optimizing lymphatic drainage in the body so important to that longevity piece?
So we use LPG for improving the lymphatic drainage. We use pressotherapy as well to improve the lymphatic drainage.
Is that those inflatable sort of trousers that you wear, and those are amazing?
That helps with the swelling, with edema. It helps to kind of improve the circulation. That will lead straight to
keep you away from Mark's office.
What he's going to tell you about. So this is very, very important to improve the circulation, to improve the the oxygen, bring the oxygen to those tissues and remove the toxins, and patients definitely feel the benefit of it.
Is it always important to be trying to do these treatments in a clinical setting? Is there anything we can do from home to sort of help optimize?
Absolutely. In terms of improving the lymphatics, dry brushing, cold or warm showers, lots of water, staying really well hydrated, healthy diet, avoiding toxins, alcohol, etc. So
living life in balance, that really exciting thing that we all love to do. Yeah, it's so true. And final question, because you sort of dipped into it a little bit at the beginning. You do have a very loyal following for your injectables, and definitely in that regenerative space, we're starting to see more and more products that can stimulate the body, I guess, to produce sort of collagen and elastin and even fat now. Why is this so exciting, and what sort of areas of the face and body are you seeing really interesting results from?
So I was never interested in the trend of beautifications and changing, altering how patients look and changing the anatomy. My main passion has always been prevention, maintenance, and just tweaking slightly, obviously, improving our skin health and how patients look like, but in a more holistic way. So we have now such a plethora of fantastic treatments that we can offer patients. We can use biostimulators like polynucleotides. They are highly purified fragments of fish DNA, very similar to ours. So they just signal to our cells to start to produce more collagen, more elastin, more hyaluronic acid. So the skin not only gets to produce more collagen, elastin, and more hyaluronic acid, so it's better hydrated, but also it's down-regulating inflammation, and then we're back to the main.
And it's such a nice icing on the cake when you've
Exactly.
Stimulated the muscles and you've sort of improved the lymph system, dealt with the cellulite, then to sort of strengthen that skin and really bring health back to the skin that sits on top.
Exactly, because I feel like doing that, I'm not only making my patients look better, I'm improving their skin health. So this is something that's really beneficial for their skin. I see patients with eczema, patients with chronic dermatitis, patients with rosacea that really benefit from those treatments. Not only the skin looks better and the fine lines are diminishing and things like that, but also pigmentation, redness, all the inflammation, underlying inflammation is coming down.
Yeah.
And that gives my patients really the reassurance that they're doing something that's really good for their skin. It's not just looking good, it's actually healthy. So that's brilliant. The other thing that we do a lot recently is we start to talk about the adipose tissue while we try to remove and control it everywhere else.
We want to get rid of the fat, and then suddenly a product comes in that's like, we can stimulate your fat, we can get it back.
Yeah, but we need to be very careful about the faces, right?
Yeah.
So we need this subcutaneous fat to just look plump and full in our faces and not look hollow.
Especially if you're on the GLP-1s as well, and you have had that accelerated sort of rapid weight loss, and some of your face or your body is looking a bit more gaunt than previously.
And it's all of a sudden patients feel like the body looks better, but the face has aged. So I use biostimulators like Profilo Structura. This is the new Profilo that helps to maintain our adipose tissue. So it helps to prevent the volume loss from lateral face, and it doesn't give patients the overfilled, stiff filler look.
The very wide face sort of look,
It gives them, it still works within our normal anatomy. It just blends in very lovely with our own tissue, and it doesn't look like it doesn't belong there, basically. So my patients love it.
Amazing. I mean, it's fascinating what you can do, sort of head to toe, face, body, every single layer of the anatomy to really future-proof it.
That's the goal.
Any questions for Dr. Aggie at the end, please do save them up, and we'll come to those later. But thank you so much, Aggie. So our next speaker is Professor Mark Whiteley, probably the most in-demand venous surgeon in the UK. There's nothing Mark doesn't know about veins and valves and arteries and whatnot. And it's very exciting to get him talking on the subject. You're wildly passionate about it, Mark, which is a lot to say for veins, actually, but you always make it fascinating. But tell us, because we're here to talk about how to build a strong and stress-free body, where does the venous system actually fit into that? Why is it so pivotal?
I think what's really interesting is how veins have had such bad press. So, I mean, even you half jokingly talk about veins, and everyone thinks about varicose veins, just varicose veins. That's because the NHS and private health insurers and doctors for many, many years have just tried to trivialise them. In the NHS, there's no experts in veins at all. There's no job called a phlebotomist or venous surgeon. You are lucky if you see a vascular surgeon, that's an artery specialist. If you see a general surgeon, he does a bit of everything. Radiologist, there's no speciality. And because of that, there's no research in the UK apart from in our clinic and one or two other places that work with us. And we go around the world where phlebology's taken off, and it's just huge. And you know, when I go to conferences in the UK, I have to talk 20 years ago, just get people in the medical space to even understand what we're talking about. And when I go abroad to places where they've embraced it as a speciality, suddenly I have intelligent conversations with researchers. And to answer your question more directly, if you actually think how much effort and thought you all put into nutrition, you think how much effort and thought you put into drinking, you've already talked about lymphatics, you've talked about circulation.